Women's Health Wednesday segment now. It is Ovarian Cancer Awareness Month, and Dr. Benjamin Margolis, a gynecologic oncologist at Albany Medical Center, is here now to share his insights on what women really need to know. Dr. Margolis, thanks so much for coming in.
Thank you for having me.
You know, we were talking off camera that this is something that is not easy to detect. There is no screening test for it. So symptoms do matter. We really need to pay attention to our bodies. What do women need to know about the symptoms of ovarian cancer?
Yeah, you know, unfortunately for ovarian cancer, there have been no screening tests that have been shown to make an improvement in survival. So we really do rely on symptoms. Because the ovaries lie in the abdominal cavity and things can grow to larger sizes, symptoms often present late. So something we talk about is bloating, early feeling of fullness, abdominal cramping, as well as some GI and urinary symptoms that can be indicative of an ovarian cancer diagnosis.
And one of the challenges here is that, you know, there are many other things that, you know, may appear to be that, and it could be ovarian cancer, it could be something else, it could be menopause.
Yeah, when we talk about ovarian cancer symptoms, we often talk about how they're non-specific, so they can overlap with many other conditions, which makes it so challenging.
So prevention is key. So let's talk about some of the things that actually increase the risk. We don't know what causes ovarian cancer, but we know some things increase our risks, right?
We are actually making some strides into the causes of ovarian cancer, and we do believe that ovarian cancer now starts in the fallopian tube. So we can actually see some of the abnormalities in the cells in the fallopian tube that lead to ovarian cancer, similar to the way that we see abnormal cells on the cervix that then lead to cervical cancer.
Interesting.
So one of the things to talk about with prevention is actually removal of the fallopian tubes.
Okay, and some of the other things that increase your risk of ovarian cancer. Let's talk about that.
Some of the biggest increased risks of ovarian cancer is age, so that it is a disease of older people. And then bigger things are a family history of ovarian or breast cancer, as well as the presence of a genetic mutation like the BRCA mutation.
Let's talk first about family history, because it is so important that we know it and then that we share it with our gynecologist. At that point, though, if you do have a strong family history of ovarian, breast, uterine, or colorectal, right, all of those could be indicators. What do we do?
I think the most important thing to do is to share that information with your physician, whether it's a primary care physician or an obstetrician gynecologist. It's also important to know the details. A lot of folks know that someone in their family had something that might have been cancer, but I think it's important to nail down the age of diagnosis of a cancer and the details of what type of cancer it is. That can be very helpful. Once you share that information with your doctor, they'll then decide if genetic testing is indicated and refer to a genetic counselor who can then see if that person has a mutation.
So get specific with your doctor on what you know about your family history. That's important. You mentioned the BRCA gene. That's a genetic mutation. And you also mentioned removal of the fallopian tube. So let's say you do have that BRCA gene. First of all, how likely is it that you develop ovarian cancer? And then, do you go that route of removing your fallopian tubes?
There's a couple of different ways that nowadays people could identify that gene. There are some direct-to-consumer genetic testing companies like 23andMe. So I think one of the most important things is that if someone finds out that they have that genetic mutation, seek official genetic counseling. Those are really the gatekeepers to all the information of what types of cancers that person might be at risk for. Most people know that BRCA genes increase people's risk of breast and ovarian cancer, but they also increase the risk of pancreatic cancer, some types of skin cancer, prostate cancer. So having someone who really is going to take a holistic view of your genetic risk and provide appropriate recommendations is really important.
And your doctor will tell you what needs to happen if you do have that BRCA.
Absolutely. And so once that those risks are identified, those genes are identified, you have a discussion with your physician about the ways to reduce risk of cancer. So that can involve special screening tests. There's some high-risk screening for breast cancer. There's the option of removal of the breasts. And for ovarian cancer, we talk about removal of either the fallopian tubes or ovaries, or you can actually decrease your risk of ovarian cancer by taking birth control pills long-term.
That was the next thing I was going to ask you. So reducing the risk, pregnancy, breastfeeding, and also taking oral contraceptives. Yeah,
those are some of the biggest ways to reduce the risk. So we know that people who have not had children are at slightly higher risk of developing ovarian cancer. And then long-term users of birth control have about a 50%, birth control pills, oral pills, have about a 50% reduced risk of developing ovarian cancer. And also the removal of the fallopian tubes, we are starting to believe is one of the best ways that we can reduce the risk. We haven't gone so far as to say that every person with fallopian tubes at average risk of ovarian cancer should go to their doctor and get them removed.
Yeah.
But we now remove fallopian tubes routinely at the time of hysterectomy because of this prevention. And for contraception, for birth control, it's now very reasonable to remove the entire fallopian tube as both a way to prevent pregnancy as well as prevention of ovarian cancer.
Such important information. Dr. Margolis, we appreciate you coming in so much.
Thank you.
Thank you.